The UCLA college has recently come out that there is a molecule called PP405 which claims to cure baldness.
Like the best time to do a hair transplant is after the age of 25.
Can you actually take me through how a hair transplant works, like a step-by-step approach? Were to say, because now we hear that in Turkey there are 5,000 follicles that are being implanted. They come back here and ask, doctor, in Turkey they're doing, and here you're saying that not more than 700 to 800 can be transplanted.
So for women, it is not like a one rule that if someone has had it in your family, you will have it. So it's not purely genetic for women.
Can you tell us some of the actionable things that people can do to actually maintain their hair health? The UCLA college has recently come out that there is a molecule called PP405 which claims to cure baldness. Can you tell me something more about this? Because I have been getting so many questions, honestly, that please give me this medication.
So it is still under trial. Okay. Very importantly, still being researched. It's very early in the stage of research, and it hasn't even been released for like a patient use, like a commercial use yet. So what they're talking about this molecule is that it is able to kind of reactivate the stem cells.
Right.
Okay, so the stem cells are what remains in the root of the hair, not the hair itself. So it's in the root, the stem cells, which is responsible that once a hair falls, the next hair to regenerate, these stem cells are the starting point. So if the stem cells are very, like say, less or dormant, then this molecule is supposed to reactivate it. So this works, this is supposed to, again, theoretically, it is supposed to work on the hair which have become very thin. Okay, so again, see, it cannot cure baldness if it has gone to a stage where the follicles are not there at all. Okay, so this molecule also will work if the follicles are there, and it may work on the follicles which are very thin, and they are saying that it could potentially work better than Minoxidil, which is the most popular treatment right now.
Right.
Because Minoxidil is not able to reactivate the stem cells that well.
So, lot of people now, once you say hair fall, right, they will talk about we are already using minoxidil, we're already using PRP, we're already using tamoxifen. So, what are these things? And a lot of people now, without even going to the dermatologist, pick it up on the counter. And then they come back with complaints saying that I used minoxidil because I saw a reel, and now I'm having hair thinning after I've stopped it. What is it?
See, so yes, Minoxidil, the point that they've picked up Minoxidil and they've started using it is a good thing.
Right.
Okay, but so many people go wrong in the way they use it. So picking up Minoxidil from the counter, that is like the starting point of the treatment, which is the right step that they've taken. But it all depends on how they use the Minoxidil. Okay, so most of the people think that using just once a day or once a week or once in 3 days, that is not the way to use it, right? So they have to use it twice a day for men and once a day for women. Okay, and it is not like the 10% is better than the 5%. So using 10% once is equal to using 5% twice. It doesn't work that way. Okay, so most people go wrong in the way they are using it. And most of the times when they start Minoxidil, initial 1 or 2 months they have hair fall.
Yeah.
So at this point they panic a lot, thinking that the hair is falling because of Minoxidil, and they stop the treatment. Now they are like, kind of having this misconception throughout life that Minoxidil causes hair loss. Okay, the next thing is once they have seen the good hair growth with Minoxidil, say they use it for 3 months, 6 months, because there are some marketing that the Minoxidil works in 3 months and then they can stop it. But once they stop it, it is going to slowly come back to where it was. Okay, it's not like it's going to cause drastic thinning. It is something like each hair has its own expiry date. Okay, so the Minoxidil is trying to prolong the expiry date.
Got it.
So if you stop the Minoxidil, it will go back towards its expiry date. That's all it is.
Got it. So can you help me understand, like, when you're doing a hair transplant, right? Who's like the ideal patient for it? Because now a lot of people come and then some are ideal, some are non-ideal. Can you explain who is it recommended for and who is it not?
Actually, I would say the ideal candidate should be at least above the age of 25.
Okay.
Okay, like the best time to do a hair transplant is after the age of 25. But ideally, yes, I would like to do it after the age of 25, only because one is they're mature enough to understand what their expectations are. Because most often I see some people in the age of say 18 to 25, where they think their hairline needs to be this low. right? So that is not at all good. And they don't want to accept that it is going to look unnatural. They want to have a very unrealistic hairline like in the middle of their forehead. And they want to fill in even the smallest gaps that they see in their hairline, which is kind of natural.
Right.
So they need to attain that level of emotional maturity to understand what looks good on them and what doesn't. So, like the hairline slightly recedes as we age, and it kind of stabilizes at the age of 25 to 28. So that also helps me a lot to plan. Otherwise, if I do the transplant like too low, and then after the age of 25 it starts slowly receding, that will also make it look very unnatural.
Got it.
So beyond the age of 25, there's nothing like nobody is like not an ideal candidate. It can be done, and there's nothing like an end age is not there. Like I can do it even at the age of 60, 60 plus. Like I've done transplants for people more than 60 also. So it has healed well also. But there, the more that I would be concerned about is their other health concerns. Like if they don't have, if their blood sugar is not controlled, if they have uncontrolled hypertension. So that is where I would like be very watchful of what procedure I'm doing for them.
Right.
Hi, I'm Dr. Sharanya, a medical graduate and a certified physician with a master's in public health and also a master's in functional medicine and bioidentical hormonal replacement therapy. I have always believed that health is more than medicine. It's about resilience, mindset, and the human stories behind every journey. Welcome to Beyond Limits. This podcast brings you conversation with experts, change makers, and everyday people who have pushed boundaries in health, life, and science. From breaking barriers in medicine and science to redefining wellness and uncovering the untold stories of grit. Beyond Limits is about thinking bigger, living longer, and going beyond what people believe is possible. And if you'd like to work with me on a one-on-one or book a consultation with me, you can reach out via the link in the description at the email therealsharanya@gmail.com. It is TheRealSharanya@gmail.com. Let's go beyond limits together.
Can you actually take me through how a hair transplant works, like a step-by-step approach? Because now a lot of people, recently we saw a dentist who did a hair transplant and the patient passed away. So can you actually explain, like, if I want to consider a hair transplant, or if somebody watching this has to consider, what is the step-by-step approach that you would take to doing the transplant?
One thing is, again, see, like once a patient has come to me, I need to see whether they really need the transplant also or not. Because most of the times their hair would have just thinned out a little bit with minoxidil. It's possible to get it back to almost normal.
Right.
They may not even need a transplant. But for those who need a transplant, which I'll be able to assess like after seeing them in person, I would the thing is I have to make sure that they're fit for the surgery. So I need to get a whole panel of blood tests done to check their fitness and get it again like evaluated with a physician to make sure that they are fit enough to undergo the procedure. Even though it's all done under local anesthesia, I still have to take this care. Because the local anesthesia, what is given is based on how their body can kind of metabolize it. So there is a limit to how much local anesthesia I can give to a person in a single day.
Right.
So, and that is calculated based on their body weight and based on how their kidney and liver is functioning. So, if everything is okay, then it's calculated according to their body weight, and only that much anesthesia I can give in that day.
Right.
Even if it's local anesthesia. So, of course, local anesthesia is much safer than general anesthesia, there's no doubt about it. But even with this, like if someone doesn't have the technical knowledge about this, and if they end up overdosing their patient on local anesthesia, that can lead to a lot of fatal complications also.
So do you think like it could have been an anesthetic complication that person?
Most of the times it is an anesthetic complication itself, or it could be that they're having an anaphylactic reaction, like that is like an allergic reaction that they're having to the local anesthesia. That is why it's very important to do we call it a test dose.
Yeah.
We have to give a test dose of the anesthesia before starting the procedure. Like a small dose is given into their skin to see if they develop an allergy. If it is not there, only then we give a larger dose.
Right.
So if that is also not done, then they end up becoming allergic to the anesthesia. Then it's very difficult to control it like at that point. It becomes like an emergency. And most of these centers, like if they're run by, say, not the doctors, they don't even have any tie-up with any hospitals, like for an emergency kind of an intervention. That becomes very difficult.
Okay. And so if I were to say, how is the hair transplant done? What is the harvesting procedure like? Who is ideal? If I were to say, because now we hear that in Turkey, there are 5,000 follicles that are being implanted. They come back here and ask, doctor, in Turkey they're doing, and here you're saying that not more than 700 to 800 can be transplanted. What is this?
Actually, see, that is, I would say, like, I've easily done 5,000 to 6,000 grafts for patients, even here also. Okay, so it matters from person to person, right? And it matters on the area which has to be transplanted.
Yeah.
If there, I mean, see, the thing is, why Turkey is becoming popular for transplant is because they're kind of marketing it really well, and
Right.
they're offering like these all-inclusive packages. Like, from you land there, you're taken care of. You go to a hotel, like all of that is taken care of. So it feels very 5-star, and it feels very affordable also for a
Right.
5-star treatment. But some complaints that I have gotten back, like some feedback that I've gotten back from patients who have gone to Turkey, is that there's nobody to take care of them once they're kind of back in India.
Yeah.
So once they step out of the country, it's done. That's it. So no one is going to take care of any complications that happens after that. So the delayed kind of the late complications of a transplant could be that the hair doesn't grow at all. So at that point, we need to see what to do and why it is not happening, or if any treatment has to be done. It's not that all the hair will die and that's why it's not growing. It can be revived. So to help them out with that, there's no one. So that is also why I feel like going to Turkey is fine, but like you need to be aware of how you will maintain the hair without
Yeah.
any guidance after that.
And what is this technique of harvesting hair? How do you do it, and how is it done? And who's like an ideal candidate? Like somebody who's had 100% balding, is it possible that he can regrow the hair?
See, the best donor area that I say, like, see, the thing is, we always depend on the person's hair itself to, like, harvest and put it in the area where the hair is not there. So the best donor area would be the back of the scalp, because generally, like, however advanced the balding is, always like a patch of hair remains at the back of the scalp. So that is kind of like a hormone resistant, or like it doesn't get affected by the hormones at all. So because of that, that hair remains. So that is a safe hair for me to take and put it in the area of the balding. Now, if suppose the entire area is bald, and if I have to take the hair only from here, that may not be enough for me. So because if I have to cover the entire scalp, then I will need even up to 7,000-8,000 grafts, which is impossible for me to get from here, because there's a limit of usually 5 to, not even, I mean, theoretically it is 5 to 6,000 that I can get from here, but it's usually around 3 to 4,000 that I can get safely from the back of the scalp. So I would say, like, ideally I would like to take all the grafts from the back of the scalp. So ideally for someone who needs up to 4,000 grafts is the best candidate. But if they need beyond that, and if I don't have enough grafts here, if they have a good beard, so then that becomes a second choice for me to take the grafts from there. And otherwise, sometimes we have taken from the chest hair as well. So it's possible to achieve the results even in a completely bald patient. But again, I need to explain to them how the results will be.
Okay.
So they may not get that complete kind of, it may not be able to completely recreate their original hairline.
Right.
But yeah, to an extent, definitely it can be improved.
Right. And also another thing is, now a lot of women, earlier women balding was very, very minimal. Now we see a lot of women who have as early as 18, lot of hair thinning, and alopecia areata, male pattern baldness, even in women, right? And can you explain about what are the types of baldness that hair fall, hair thinning that you see, and why is that like so much it is happening? Because earlier, if you ask our mothers and grandmothers, they'll be like, we had long, luscious hair that was till our toes or our, bums. Why is it that now it's becoming harder and harder to maintain good hair? Why is it harder and harder to maintain long, luscious hair? Everybody loves it, men, women.
Yeah, I
And
mean, it's a sad truth, because even about myself, right? My mom has better hair than me, and that I've always questioned. So it comes like it. There's a lot of like our lifestyle that comes into play here. So for women, it is not like a one rule that if someone has had it in your family, you will have it. So it's not purely genetic for
Yeah.
women. There is definitely some role of genetics for women also, but it's not 100% just that. So I cannot say like once you've started balding, you will continue, or like if your dad is bald, you'll pakka go bald. It's not like that.
Yeah.
So for women, it's so much about like what kind of stress they have in life. because a lot of like hormone fluctuations happen for women.
Yeah.
So the stress itself can cause hormone fluctuations without even having PCOD.
Yeah.
So most of the women think that if they have PCOD, they need to have irregular cycles.
Yeah.
That is also not the rule.
Right.
Right. So they can have PCOD kind of symptoms even without affecting their cycles. And there is something called as a receptor sensitivity. So even if their hormone levels are completely normal, the response of the hair to the same level of hormones will be altered, and that is again dependent on their unhealthy lifestyle or a sedentary lifestyle, or if their diet is not good. Like all that matters a lot. And if the immunity is low, and if they're repeatedly falling ill, like say they repeatedly get fever, typhoid, dengue, like so those things can also trigger a lot of hair fall. So at that point, when so much hair fall gets triggered, and especially women go through say the delivery, so post post pregnancy, post delivery kind of a hair fall can also kind of trigger, like, so when there's lot of hair shedding at one point, the recovery from that can become very slow depending on how their lifestyle is. So
Right.
if they have an unhealthy lifestyle, the recovery becomes so slow that it shifts slightly into the balding pattern.
Right.
So the balding pattern is where the new hair that grows is not able to fully replace the pre-existing hair. So one hair that falls, the next hair comes on shorter and thinner. Again, the next hair comes on shorter and thinner. So because of it could be the nutrition, it could be the lifestyle, so it's not able to catch up. Okay. So at this point, they have to kind of make sure that they're taking the treatment, because for women, it's not something like they need to use it lifelong. So the minoxidil, what I generally advise for male patients is that they need to use it until they want the hair. But for women, it's not that way. So there's no hard and fast rule that they need to use it lifelong.
Right.
So they need to use it until their hair stabilizes, until their lifestyle stabilizes. And after that, I have seen that even if they don't use it anymore, their hair remains really nicely.
Great. So now, normally, like you said, right, women, during their menopause, during different phases like pregnancy and all, have hair fall. Now, if I were to say that now all of us, when we brush our hair, we have hair fall. Suddenly, like a lot of people come to you, maybe just running and saying that, I have this much hair fall. How do you kind of say what is normal, what is not?
See, so losing up to 100 hair per day is normal, because it is something called the shedding phase of the hair. So that is called the telogen phase. So where the hair is in the resting stage, it has finished growing and now it is ready to fall, so that the next hair can grow in its place.
Okay.
Okay, so in this stage, at least 10% of your hair remains in this stage. 90% of your hair is still in the growing stage, which is good. Right, so this 10% is roughly equal to 100 hair per day that you are losing. Losing this is okay, and by this I don't mean you need to sit and literally count every hair that that is falling, but it's roughly like a small bunch of hair every day. It is fine as long as your hair is able to grow back.
Right.
Now there is like I mentioned, like if we are under stress or if you have fallen ill, so that 90% of hair which is in the growing stage, almost like say 30-40% of that suddenly shifts into the falling phase. So now instead of the 10% which is falling, it's almost 30-40% which is falling.
Right.
So that is definitely more alarming. So if you're losing more than 100, more than 150 hairs per day, that is definitely something alarming which your body will not be able to catch up to.
Right.
And at that point, you have to take nutrition supplements like a multivitamin supplements, use those kind of hair serums. I wouldn't say minoxidil at this stage. It will be a different, there are different types of hair serums that can be used. And we need to see why the scalp is so inflamed. We need to see whether there is any other procedures that can be done at this point to kind of control the hair fall.
Right.
And there's also all these low-level laser light devices, or the red light devices, green light devices. So they come as caps or laser combs. So all these definitely help because they kind of reduce the inflammation in the scalp, and they shift that 30-40% back into the 90%.
Right. So now, when it comes to hair, right, what are some of the questions your patients come up with? It could be realistic, but I want to know what are like some of the unrealistic expectations that they have.
Most of their questions are to do about home remedies. So in their head, if they do a home remedy, it definitely works better because there's no side effects. So they want me to suggest or validate their home remedies. So there are people who, I don't know, they mix everything possible. They mix hibiscus oil, the egg white, apple cider vinegar, like whatever they get in their house, they make a concoction of it and then they want to apply it on their hair. And now they're convinced that their hair is growing from that. And when I ask them to stop it, they're almost they get very offended that I'm asking them to stop it. So, and they're not able to accept the fact that they should not oil their scalp if they have dandruff.
Yeah.
They feel like oiling the scalp is making their dandruff better. So this is like the biggest misconception, because see, the thing is that dandruff is nothing but a fungal, like a fungus, which is present on everyone's scalp. That fungus is there on everybody's scalp, and that fungus overgrowth happens when the scalp is very oily. So that is why people with oily scalp will have dandruff, and now they try to oil it more. The dandruff is only going to become worse in that scalp. And there are some oils like say neem oil, or even tea tree oil, which is supposed to help the dandruff. It definitely does, because it kind of blocks the fungal growth and it is anti-inflammatory. But it depends on how long you're leaving the oil on the scalp for. So if you leave it anything beyond 20-30 minutes, it's not going to work as an anti-inflammatory. Now it's just going to remain as an oily layer. So whatever the anti-inflammatory has to work, it works in that first 20 to 30 minutes only. And then you need to wash it off. Now if you don't wash it off, you leave it on the whole day thinking that it will give you more benefits by leaving it on the whole day, you're only going to attract more dandruff into your scalp, and dandruff causes a lot of hair fall.
Right. So now coming to that, most people don't even think that scalp is a huge part of their hair health, right? Can you give us a little bit insight on what are the disorders you can have of the scalp, and how do they cause hair fall, and in fact more like shed light on scalp health?
Actually, in fact, I can. You might have seen doctors, like they kind of pull the eyelid down, or they ask you to put your tongue out to see whether you're pale, and to check whether your blood count or the hemoglobin is low. So this, in fact, I can pick it up by looking at your scalp. So there is something like a coiling of the hair, right? So if I see a lot of coiling of the hair at the root level, I know that you're deficient in iron. So this is something that gives me an insight into how your health is by just looking at something as simple as a coiled hair in your root. And if you have like the constant kind of a scaling on the scalp, and that kind of like a dandruff, but not exactly like the dry kind of scales at the scalp and the itchy scalp. So I know that you might be exposed to hard water, or I know that you might be consuming whey protein, because whey protein can cause a dandruff, kind of an inflammation in the scalp. And then next is like if they are having kind of a patchy hair loss, something like which is called alopecia areata. So they end up losing hair in patches, like a complete patch of hair is just gone overnight, or like they suddenly notice it in their shower. Now this gives me an indication that they might be exposed to a lot of stress, because that is like 9 out of 10 times stress is the most important reason for having the patchy hair loss like that. Then I know that I need to check like if they have any other autoimmune conditions. Like I need to check if they have a thyroid issue, or if they have any family history of thyroid or rheumatoid arthritis or any other autoimmune conditions like that. So like hair tells a lot about your internal health also.
Right.
And there are some things which I see on the hair and which I know automatically that it can affect their skin as well. Something like psoriasis. So if I see a patch of psoriasis on the scalp, then I know I need to check their whole body for it. And then the psoriasis can even affect like their metabolic also. Like so it can expose them to say diabetes or cholesterol at a much earlier age than others.
Right.
So, and even as simple as balding. So even for males with balding can also have all these metabolic kind of syndrome with diabetes and cholesterol and dyslipidemia. All of that can happen at a much earlier age. So it's important to kind of get these blood tests done, evaluate them completely. And then there's an endless list of like so many conditions in the scalp that can happen. So like the hair loss that happens where the hair never grows back. So that's called the scarring alopecia. So all of that becomes very important for me to diagnose earlier to kind of arrest the progress of the condition.
Right. And another thing that you mentioned, right? A lot of people now, does whey protein actually cause hair fall? What is it? Like, there are so many people who say that it doesn't cause. Some people say it does cause. What is it?
Whey protein, see, it comes in two forms. Okay, comes as whey isolate and whey concentrate. Now that the difference in this is how it is prepared. So the whey isolate is a more refined way of preparing, where they remove all the dairy part of it. So because whey is basically coming from the milk, or the fermented like the curd, right? So it comes from the curd. So because of that, it contains all the dairy parts of it. And this dairy product, when you consume the whey protein, that is going to spike up your insulin levels. Okay, so that insulin levels, when it spikes up, that spikes up the male hormone level or the androgen level in the body. That is again responsible for making your scalp and skin oily. So it's ultimately like that dairy product which is having the same effect on your skin as your own like kind of like the oily skin. Okay, so whey isolate has this dairy derivatives which is going to spike your insulin and then the androgen and then make your scalp and skin oily. The Whey isolate has almost minimum or almost nil of these dairy products. So Whey isolate is still much safer. Whey concentrate has almost 85%, like it's very variable. Okay, so it can have up to 85% of just the adulteration with the dairy derivatives or the fats, and only 15% of it can be the pure protein actually. So if someone is able to get a good source of whey isolate protein, I would still be okay with that. And if someone is having like PCOD, or if someone is already having like that androgen influence kind of a condition, like say male pattern baldness, female pattern baldness, I know already their androgen levels are high. So I don't want them to take the whey protein, even if it is an isolate. I don't want to take that chance at all.
Okay, so then the better option would be a plant-based protein?
As of now, yes, because as of now there is no kind of enough studies to say that plant protein is causing any problems like the whey protein. But say plant protein has its own kind of controversies, that it is kind of having like these heavy metals. Okay, so we need to again choose a good brand, because some amount of heavy metals is normal to be there in a plant protein. It all depends on the levels of the heavy metals, because plants are like growing in the soil, right?
Right.
Soil is rich in, say, the groundwater. Groundwater is rich in heavy metals, so that's all it is. So
Right.
that much amount of heavy metal exposure we have even in the drinking water. So we need to know the good brand of plant protein before we consume it.
Right. Then the next thing that comes up is, does high testosterone cause hair fall?
This, if high testosterone were to cause, see, this is possible in females,
Right.
right? So in females, we have two types of balding. So balding with normal levels of androgen or normal levels of testosterone, and balding with high levels of testosterone. So that is usually seen in PCOD. So this is definitely, it plays a role in women. And if something like that is there, like if they have a higher level of testosterone, then definitely giving them hormonal treatment will work. So I need to bring down the level of testosterone in their blood. But for males, it is not like that.
Okay.
So for males, most of the times, like 99% of the times, the blood or the blood tests come back normal.
Okay.
If the high testosterone levels were responsible for the hair loss would have been universal. Like it
Okay.
would have affected the entire scalp and not just the pattern scalp.
Got it. So, Apoorva, can you give me an idea of what is the process of hair transplant like? How many hours does it take to actually do the transplant? What are the steps, whatever?
Yeah, so see, there are mainly, like say, two techniques of doing the transplant, right? So there is one called the FUT and one is called the FUE, or otherwise, like, people like to call it the scarless surgery, the FUE technique. So why it's called, so let me explain. So the FUT is the like a little bit of an older technique, so which mostly it's not practiced nowadays. Very few cases, very exceptional cases, yes, the FUT may be required. So here, like a whole kind of like a narrow strip of the scalp is completely removed from the back, like the donor area, and like a 1 to 1.5 centimeter length of a strip is removed, and from that each follicle is kind of dissected. Individual follicle is dissected, and that individual follicle is placed in the area of the requirement. In the FUE, there is no strip removed from the scalp. So it is the individual hair itself is removed using a punch. Okay, so punch, to put it in a simple way, it looks like a pen cap, which fits just around each individual hair. So it's like a very sharp blade, or like a very sharp pen cap, which just rotates around each hair, and then we are able to individually extract each hair intact with the root. So the way we extract each of these hair is such that we give enough gap. Like if I'm removing one hair, I leave at least 4 to 5 hairs around it. Then again one hair, then again 4 to 5 hairs around it. So there's always like a limit to how many hairs I can remove because of this. So because if I remove more than this, then it will start looking bald in the back. And if I remove it like this, these hairs I'm removing it with the root. So you have to understand that these hairs are never going to grow back once I remove them. But I'm removing it in such a way that there is not going to be any difference at all in the hair growth once it is removed. So the hair at the back of the scalp will still exactly look the same, even if I have removed up to 5,000 hairs from the back of the head. So that is not a problem at all. And even in the back of the hair, I have a limit to where I can remove the grafts from. So there is a complete like a measurement that I have to follow, which is called the safe donor area. And if I go beyond it, I can get the hair, but the longevity of this hair is not, I cannot guarantee. So it could be like if I have extended beyond the safe donor area, then those hairs will not remain as well as the other hairs.
Okay.
they may thin out faster. So that is where I really need to take a calculated decision. If, like, suppose if a patient doesn't have any beard hair at all, and this is the only source of my hair, then I might have to go into the beyond the safe donor area as well. And this FUE, why it is called scarless is, like I told you, like once the hair grows back, all the gaps get covered. And now even if the patient were to completely like shave his scalp again, it will not look like I've done any transplant there. So because the scars are so small, it's like it's less than 1 mm. Right, the scars are so small, each scar is so small that it is not visible to the eye.
Okay.
But the FUT scar, because I've removed a whole strip, it is like it looks like a moon-shaped scar at the back of your head. So if someone were to shave the scalp, it will look kind of like as if they've undergone like a brain surgery or something. It looks more aggressive.
Right.
Now, once I have removed each of these individual follicles, then I have to make place for them to, like, put it in the front of the scalp where the requirement is there. So this is called like the slit making. So where I need to, it's kind of like planting the saplings, right? I need to make space for them. So using the small blades which make spaces just enough to hold each individual hair. So that has to be again created manually, like individually. Then the hair what I have removed again has to be placed into them individually.
Okay.
So there is a time called as the out of body time. So the grafts can stay, like once I've removed the hair from the back of the scalp, and by the time I put it back into the front of the scalp, there is a time limit for me, right? I need to, as much as possible, put all the hairs back into the scalp within 4 hours.
Okay.
Otherwise, the survival rate of these grafts go down.
Okay.
So I cannot be too I cannot remove like altogether say 8,000 grafts, and then by the time I put it back, it is impossible for me to put 8,000 grafts in 4 hours. So I need to plan it in 2 sessions. I need to do first 4,000 grafts, put it inside, then again remove 4,000 grafts and again put it inside. So that is how I need to plan it. So this whole procedure of removing the graft, making the slit, and then putting the graft, it can easily take for say a transplant of say 2,000, 2,500 grafts, it can take me 5 hours.
Okay.
Yeah, it can take me easily 4 to 5 hours to finish this. And then again there's the anesthesia and all of that. So now the anesthesia, how I give the local anesthesia is where I'm doing the procedure. So if I'm doing the step of removing the graft, I give the local anesthesia in the back of the scalp. Then once I move to the front and then I have to make the slits or put the hair, then I give the local anesthesia in the front. So giving the local anesthesia itself feels like small injection pricks. After that, the scalp remains numb easily for anywhere between 2 to 4 hours. So that is enough for me to finish the process then. So that's how it goes.
Right. Now, with regards to this, right, what could be the cost of hair transplant itself? Because so many people go to Turkey saying that it's cheaper. And what is the real world image of Turkey?
See, the cost of hair transplant, sadly, in India, it's very variable. Okay, because the people who are experienced, by people I mean like the certified qualified surgeons, that is they could be either the plastic surgeons with an MCH degree or they could be the dermatologists with the MD degree. So only as of now, the Medical Council of India has approved only these 2 doctors to perform the hair transplant. Of course, there's another Dental Council of India who has also approved the OMFS surgeons, that is the oral maxillofacial surgeons, to perform hair transplants, but it is a completely different body. Like that's a Dental Council of India and this is the Medical Council of India, and most often they don't agree with each other. So that's still an ongoing battle. But yeah, as of now, these are the only doctors who are approved to do the transplant. And if someone is experienced enough, so the rate varies with that. So if someone who's like not as experienced may charge lesser, someone who's more experienced may charge more. But that doesn't mean that suppose you pay more, you will get the result.
Right.
So nothing is guaranteed, right? So you need to go by trust. You need to find a good dermatologist or a good hair transplant surgeon. And because of this, so much of this competition in the rates, there are people who are not even certified. They're just technicians, or they would have assisted doctors in doing this transplant just as a technician. But now they have opened their own centers and they're doing the transplant. Because they know the technique. They don't know how to manage complications. They don't know about the local anesthesia. Like no technical, kind of it is just a kind of like this mechanical working. There is no knowledgeable working there at all. They do it as cheap as 10 rupees per graft.
Okay.
So if I were to put 4,000 grafts, 10 rupees per graft would cost 40,000. Right? So that is very cheap. And even that, like now because of that option, if I were to charge say 50 rupees per graft, that automatically looks very expensive for the patient and they feel like I'm trying to scam them.
Yeah.
They feel like, what is so different in what you are doing that I need to pay you so much. But they don't, like, the patients need to understand that they're paying for their safety, that they're
Right.
paying for the results. Because the results also, see, it's not like instant results. It's not like I do the transplant today and tomorrow you have a full head of hair. It takes easily 8 months to 1 year for you to see the results from the transplant. In that time, whether going to a doctor, whether going to a center which is doing it at 10 rupees per grat will take responsibility for your hair, absolutely not. They will let go of you very easily the moment the transplant is done. They don't call you back, they don't entertain you in their clinic. So I've seen many cases like this. Then after having a bad interaction with them, then they come to me saying, I want to continue the PRP here, make sure my hair grows. Whereas I'm not even responsible for the transplant.
Yeah.
But now I'm personally invested in getting them the results, so now I'm getting stressed about it.
Yeah.
So it's something like this.
Yeah.
Something very similar also happens in Turkey because we don't know who is doing the transplant there. There is no details disclosed. There is no, we don't know, we know too little about it.
Yeah.
So now when the patients come back from there, again, there's nobody who shows real interest in their follow-up, who doesn't show, they're not at all bothered about how their hair grows.
Yeah.
And now it becomes kind of our responsibility, like my responsibility to ensure that their hair grows from a transplant, which I didn't do at all.
Right.
So that is the reason it has to be very, like the patient needs to pick the right person for it. They need to pick the right dermatologist or the plastic surgeon for
Yeah.
it and follow up with them regularly to get the best results from a transplant.
I think this is very valid in what you said, is that it's not a one-stop solution. It's not like you just go to Turkey and then your hair is growing the next month, right? So I think it's very, very important that people are educated about this, that it's a journey that you need someone to kind of assist you with.
Yeah, they need the guidance.
Yeah. And the next thing is, a lot of men have like patchy beard or no beard. Do you do transplants for that? And have you got any cases wherein, they would have done a transplant outside and then come to you?
Yeah, actually, see, the thing is, with beard, it can be very tricky. So first of all, like some patients, like some male patients expect that their beard should grow with some beard oil, or they have started, like the marketing is really good. Okay, so they use all these beard oils for the longest time, or they use minoxidil also on the beard. Minoxidil can cause some amount of hair growth on the beard, but it's very temporary. So the hair growth is happening as a side effect of minoxidil. It is not exactly causing their beard hair to grow permanently. So, and it is never going to be as thick as their actual beard hair. And so the treatments itself, like without a surgery, will not work to get the beard hair. If at all, it improves with age. For some people, like they don't develop a full beard until the age of 30. So I would sometimes advise my patients to wait until the age of 30 to see if they develop it out of their own genetics. Then beyond that, if I really have to do something, then it has to be a transplant only. And even then, I really prefer to do transplant only for a patchy beard, so that I can just fill the gaps. That makes it look very natural and very good. But if I had to recreate the entire beard, that can be very tricky because the face contour is like very different in different areas. So especially when it goes over the bone, like the chin or the jawline. So the angle at which the hair has to exit is very different versus the angle at which the hair has to exit from here. So following that pattern is very difficult because on that day of the transplant, I would have done, right? I would have followed the angle. But then from the next day onwards, they're back to eating food, they're back to chewing, they're back to talking. That can slightly alter the angles again in the way the wound heals. So eventually the hair that is growing out, especially in the lower jaw or the chin, it can end up growing at a little bit more kind of a vertical direction.
Yeah, more like, the scalp hair where it looks like the length and everything is like what do you say, like a lion's
it looks,
mane.
exactly. So it can look a little bit unnatural, especially around the chin and the lower jaw.
Yeah.
So which is why I don't really prefer to reconstruct a whole beard. But still, if it has to be done, it can be done.
Yeah.
The patient needs to be counseled about this, and like if they're still ready to accept these things, it's not going to look very awkward. But I'm not a big fan of it.
Right.
And there are other centers who do it. Like, I don't know, they're very daring about it. They do it, and I've seen it go so wrong. And now the patient, like this one of my patients, like he refused to go to work after his beard transplant. He spent a lot of money getting it done, and now he stopped going to work. He stopped socializing. He's just at home depressed because his hair looks so unnatural now that it's growing kind of outward like a lion's beard. like a lion's mane, right? So that looks it was looking very bad for him. So now I have to spend like 6 to 8 hours to remove each of those hairs from his face so that it doesn't grow back again. And there's also the risk, if I keep removing the hair like that, there's also the risk that it can leave some amount of scars on his face. So he was so kind of depressed about this that he was ready for anything but to have the hair on his face. He didn't want the hair at any cost. So that also becomes very challenging to manage.
Yeah. And also the next thing is, do you get like cases wherein they have gotten a hair transplant somewhere else and now they don't like the results, or they're saying that, we are not happy with it, and then they come to you?
So there are two types. Okay, so one is where the hair transplant has been done very badly, right? So the hairline, what we say like the front, has to look very natural. So the ways it can go bad in the hairline is if they have literally drawn a straight line across their forehead. That looks like a doll's head.
Yeah.
So that looks very bad, right? And the next thing is if they've not followed the angle of the hair properly, if the graft have been inserted in such a way that the hair is now growing like this instead of growing like this, right? So if that happens, again, that is a problem. It looks really bad. And by bringing the hairline very low, what happens is with your facial expressions, like as you raise your eyebrows, even the hairline starts moving. So that also looks very unnatural. So this is, and sometimes like in the hairline, it's very important to put single hairs, like just one hair coming out of one root. That is very important to follow in the hairline. But many centers, they don't care too much about this. They just put bunches of hairs like in each root. So now it's growing like a bunch here, and that looks very unnatural. So these kind of hairline kind of damage that has happened, the only way for me to correct it is by removing all those grafts. So it's a waste of having done the transplant itself. Now the second thing is where they have done a good transplant, all the results were great, but they have failed to advise the patient to how to continue the treatment. So the patient has not bothered to use minoxidil, they have not bothered to take any treatment after the transplant. So they saw the good results after say 6 to 8 months, and then they stopped doing everything. Now within a span of 1 to 2 years, all the hair has deteriorated. So now they come back to me saying that they spent and wasted so much money on the transplant. Now the problem for me is they don't have enough grafts for me to plan another transplant because so much of the grafts have gotten wasted in the first transplant.
Right.
And even at this stage, if I were to start minoxidil, I don't know if the results will come back or not.
So what is the treatment that you have to take after a hair transplant?
It depends on how much of their original hair is existing on the scalp.
Okay.
So the transplant is done either to fill the gaps or to completely refill the scalp. If I'm completely refilling the scalp until that hair grows, say for 8 months to a year, if they use the minoxidil, that is enough. Or even up to 1.5 years, that is enough. After that, we can plan to slowly reduce the minoxidil. It's not like they need to abruptly stop the minoxidil. They need to slowly, kind of reduce all the treatment that mainly includes the minoxidil, the multivitamin tablets, and shampoos. So they need to slowly kind of taper it off and see if their hair is able to maintain. For that, they need to stay in regular follow-up so that I can compare their photos, check their scalp. And this is about me completely refilling the scalp. It is possible to stop the treatment. But if I have filled the gaps in their hair, then the density now depends on their existing hair plus the transplanted hair. Now, these patients have to maintain with minoxidil almost like say lifelong or until they want the full head of hair. Because if they stop using the minoxidil, whatever I've transplanted will stay. But their existing hair will start thinning out. Now that again looks like gaps in their hair. So then again, if I have to plan for another transplant, it becomes a little difficult and challenging.
Right.
So, yeah.
Okay. Now, the next thing that I want to come to, which is like, very, very common, and it's like people want to use so many home remedies on their hair. They'll come with onion oils. Now, a lot of companies are also selling onion shampoo and all of that. What is your take on it?
Onion, it has, so all of these home remedies definitely have some science to it. I wouldn't completely discard it. Because there is this new molecule coming for treating balding, which is derived from turmeric, right? Not for balding, sorry. This is to treat the excessive facial hair growth for women or hirsutism. So it was an ancient practice, or even now some women practice applying turmeric on their side locks to reduce the hair growth here. But it was causing more skin damage than affecting the hair growth itself. So of late, I've been discouraging patients from doing that. But now there's a new research which says that the turmeric extract is able to control this kind of a hair growth. So definitely there is some science to all these home remedies. So why onion oil is so famous in treating baldness, or why people are so convinced about it, is because onion oil is acting like a kind of like an irritant on the scalp. So by irritating your skin, it is able to improve the blood supply there. It's able to kind of attract some form of immune harmony there. So it kind of reduces the inflammation and it improves your body immunity at that spot where you're applying it. So it kind of strengthens the hair there by improving the blood supply. So this is how it is supposed to work. But like it works it has a very mild effect. I wouldn't say it is equal to minoxidil at all. Right? Applying onion oil maybe even 10 times a day is not equal to applying minoxidil once a day. And again, like I said, the oil has its own side effects. The oil is only going to make your dandruff worse.
Yeah.
Right? So using onion as a shampoo or a oil or like say a serum, I'm okay with that as long as they rinse it off and as long as they're not having any side effects with it. I would never recommend someone to extract, like say, the raw onion juice and then apply it on their scalp as a hair mask. That is something that I wouldn't recommend because that causes more scalp irritation than benefit.
And also, I think the concentration of the onion extract is more important than the amount of oil. And normally, the concentration in these shampoos and oils is so minuscule.
Yeah, they're not even mentioned, in fact.
Yeah.
They don't even mention it. So we don't even know like what is going on in that shampoo or the oil, whether it's actually even containing onion at all. We don't know.
Right. Right. And also there are like other home remedies, like they will apply hibiscus, henna, and saying that it will cause better hair. And then some people apply indigo powders on their hair. What is this? Should it be done actually?
But hibiscus, again, all of these, say neem oil, hibiscus oil, all of them work in a way to reduce the scalp inflammation. So by that, it may improve the dandruff, it may improve the hair growth, but it has a very mild effect. But yeah, so it has to be always taken with a pinch of salt, right? So you can't just assume that that is going to cure your baldness. And so you need a proper guidance for it. And I would say never use all these in the raw form. Always use the extract form from a good source, right? Like a good brand. When it comes to say indigo powders, that is like the hair dye you mean, right?
Yeah.
So when it comes to hair dye, I would never recommend someone to use a powder-based hair dye, which has to be just mixed in water and applied. That has the highest amount of say PPD and chemicals, which can cause a lot of hair dye allergies. And hair dye allergies, to be honest, it can even be fatal also sometimes. So that is something that they should not take lightly. Next thing is I would recommend them to use if at all they want to use a hair dye, better to use something which is a conditioner based hair dye, which has to be mixed with the conditioning and the developer. So those kind of things are still slightly safer because they're supposed to be ammonia free. And now we have the hair dyes which are even PPD free. So if at all someone really has to use it, I would recommend the PPD free and the ammonia free hair dyes. But again, it has to be used only when really required and not on a regular basis. And if they have a known hair dye allergy, then they have to avoid it at all costs.
Right. And the second thing is now when it comes to hair fall, right? A lot of influencers promote derma rollers. And they say that you can put your minoxidil in it and do the derma rolling at home. And because it creates basically small, tiny
Like
incisions
punctures,
or punches, it helps your hair grow. Should somebody be using this at home?
So see, derma roller, like you said, it's like a small, tiny instrument which looks like a rolling drum. And that drum has a lot of needles on it, very small needles on it. And when you roll it on your scalp, it is, like you said, it causes micro injuries in the scalp. Now, causing these micro injuries helps in the hair growth, definitely, because as the injuries heal, like the growth factors are released and this helps to grow the hair. This is like scientifically correct, right? But it depends on how you're doing the derma roller. So it is impossible for someone to do it on themselves accurately. Either they'll be overdoing it in one spot or they will be using the same derma roller every time. So what happens by overdoing it in one spot is, or using the same derma roller every time, is you're going to cause more injuries. It is not going to be micro injuries anymore. It is going to be so much injury that it is going to scar your skin. And if the scarring happens on the skin, the hair is never going to grow there again. So this is where it can go wrong. And most of us are either right or left hand dominated. So one part of the scalp will always get better treatment than the other part of the scalp. And by the time we reach the other part of the scalp, we are exhausted, we are fatigued. So we don't have the same kind of commitment to treat the other side of the scalp. And it is all about visualizing what the micro injuries look like. So that has to be done only by a certified, like say, a dermatologist, Or I would say like see, doctors in general are better kind of suited to do this procedure, so always going to a dermatologist would be better, because I need to visualize the microinjuries happening in your scalp and then rub the medicine onto it. And it can be quite painful, to be honest, right?
Yeah.
So when it is that painful, definitely people cannot do it like properly
Yeah.
at home. So I would, and then there's a lot of hygiene issues in how they're maintaining the derma roller. So one derma roller should never be used more than 3 times on the scalp, and how you store it in between your sessions. And there are people who do it daily. It should never be done daily. And like, it depends on the length of the needle on the derma roller. You can use it as once a week or once in 2 weeks, once in a month. It all depends on how long the needle is on the derma roller.
Right. So definitely it's like it should be done under supervision,
Yes.
and maybe you would give them some kind of a local anesthetic because it is definitely
Yeah,
painful.
it can be like if they can't tolerate, then the local anesthesia, like that can be applied as a numbing cream, or it can be given as an injection. Or some people are just comfortable with a vibrating kind of a massager on the scalp as I'm doing the derma roller. So it depends on the pain tolerance of the patients, but it's never recommended. I would never recommend anybody to do this at home on themselves.
Are there some like personal experiences you want to share which patients should really avoid because it's causing more damage than benefit? Or if you have some stories of patients where you have seen that it's unnecessary damage.
Yeah, so I think I think this whole AI and Google has helped us a lot, but it's also like causing so much damage to patients' mentality, like the way they think, the way they want the treatment. I see a lot of my patients reading so much on Google and like asking ChatGPT what they're supposed to do for their hair. I've had a patient who is using minoxidil, who is taking the tablet form of minoxidil, tablet like the dutasteride tablet, the finasteride tablet, which are all the hormone tablets. He's taking all of it, right? And he's using some other, say, like all these over-the-counter serums, the hair serums that are available. He's using everything possible, and he has come to me saying he's not getting results. But it is really not required for him to use so much. He's going to end up having so many side effects from it, and he's barely used it for a month or two, but he's having like this now unrealistic expectation, because according to him, he has tried everything possible, but that is not even the way to take these things. So that I feel like Google and ChatGPT is kind of really making my job difficult in this way, that it's so difficult for me to convince the patients what they're doing is wrong, because
Yeah.
they're like, no, Google said so. So
Yeah.
I really don't know how to, like, it's becoming a challenge for me every day. So I kind of had to read up on Google and ChatGPT to see what kind of answers it gives, so that I can tell something different to the patient.
Yeah. So another thing is now as a personal this thing, how does like dealing with patients every single day with so many kind of issues, whether like normally when they say, oh, it's dermatology, it's not like such a serious thing, right? How has it changed you as a person, or how has it made you as a person?
I feel like it has made me very patient as a person because it takes a long time to counsel patients. So the treatment, what they've read on Google versus what I'm giving may more or less look the same, right? But it's all about how I'm explaining them how to use it, and how
Right.
to expect the results, when to expect the results, and what happens if they don't use it. So that kind of a guidance and counseling is so important, which, like, it has made me realize, like, it's not as simple as I write a prescription, ask them to use it, and then send them home. Now I see them again 2 months later, they're at the same kind of, like, I have to start from scratch again if I have not explained to them properly. So initially, like, I have done my master's in a government college, so there we barely spend 5 minutes, 10 minutes with each patient, because it's all about finishing the patients at that point. But now in my own clinic, I take anywhere between 30 minutes to an hour with each patient minimum, right? Because I want them to understand the root cause behind what is happening to them.
Right.
Even if it's as simple as it's like, it could be just the skin, it could be just the hair, but it's not as simple as that. It
Yeah.
could be like their internal health which is affecting their skin and hair. So it takes a lot of patience to counsel everybody and make them understand what is going on.
Right.
And most of the times they don't want to accept that something's wrong with them. They want to blame the treatment for it, saying that it's not working. So now they're off to another doctor. They say, like, no, that didn't work for me, now you give me something different. But they don't want to accept that it's something in their own body that they need to work on, and the results will be really good.
Right.
So that is where I've learned a lot of patience in trying to make them understand.
Can you tell us some of the actionable things that people can do to actually maintain their hair health?
One is, I would say, avoid oiling your scalp. If you notice a greasy, oily, or like a dandruff-filled scalp, like, they should never oil their scalp. Oiling their hair is still okay. Don't use hot water for washing your hair. that damages your hair a lot. So lukewarm to say cold water is okay. Then I would say like don't use. I mean, if you're struggling with say hard water, right? There's no like it's not a problem that you're having the hard water. You can manage it by using say these hard water filters or using a good quality conditioner and shampoos. It is still possible to manage the hard water damage. So if I were to recommend someone to wash their hair daily, doesn't mean that their hair will get more damaged because of the hard water. That can be managed, not a problem. If some people are going to say the gym, then I would advise them not to take whey protein until they know for sure like they don't have the PCOD or the male pattern baldness. So if someone is having these conditions, then they should not take the whey protein. Then if they and of course like after the workout or after the gym, if they have a sweaty scalp, they need to wash it off immediately. Helmets don't cause hair fall, right? Helmets cannot cause hair fall or balding. Why this kind of this conception is there is because of course wearing helmets for a long time, and if the helmet sits very tight on your scalp, it can constantly keep pulling on the hair. That is the same effect as tying your hair very tightly. That constant pull on the hair is going to thin out your hair.
Yeah, that's like traction balding, right?
Correct. So that is what is going to happen with the helmets. And helmets can also cause a lot of sweat buildup inside the scalp. So that can cause dandruff, that can cause hair fall. So that is how the helmets can cause a problem. So wearing the helmet itself is not a problem. That does not cause the baldness. So we need to look deeper. So whatever is going on with your scalp or skin, like don't ignore it. Just seek help at the earliest so that your treatment becomes easier for you.
Right. And the next thing is, what should be like a daily hair care routine look like? When should people wash their hair? How often should they be washing it?
If someone has an oily scalp, I would say wash it daily if possible. If someone goes to work out daily, if they have a generally like a sweaty scalp or they work out regularly, they have to wash off the sweat so they can again wash it daily. If not, alternate day would be better. So I would say like an alternate day head wash is still like good for a normal to oily scalp. For someone with a very dry scalp or like their scalp is used to kind of like a less frequent washing. Say I know people who wash it once a week and they have like really good hair. So if their scalp can handle that, it's fine, not a problem.
Right.
There's no rule as such. But only for someone with an oily scalp, I would definitely recommend either daily or alternate day head wash.
And this is a shampoo wash.
Yes, it's with the shampoo. And if they have dandruff, just the regular, like say the over-the-counter shampoos will not help. If they have dandruff, they need to seek help. Depending on the severity of the dandruff, they need to use that particular medicated products. Otherwise, they will notice a lot of hair fall.
Right. And now the last question is for people who are into sport and who are into swimming and water sports and things like that, right? What the normal conception is that since you're swimming, your hair is falling. What is this right? And what should people do?
The swimming, like the swimming pool water has an effect on the hair which is very similar to the hard water because of the chlorine buildup that happens on the hair. That makes the hair very brittle and that kind of breaks off the hair much faster. So what they can do is, of course, like most of them will be wearing a swimming cap, of course, but they can even oil their hair a little bit before putting the swimming cap. If possible, and they have to basically use a very good conditioner after every wash. They should not let their hair dry just like that after coming out of the pool. They have to rinse off their hair. They have to rinse off the chlorine buildup on the hair, and they have to use a good conditioner after every wash. And once in 2 weeks or so, they can use these clarifying shampoos, which will completely remove all the mineral buildup on their hair. This clarifying shampoo should not be used too often because it can strip the normal minerals also from your hair. So I would recommend it only maybe once a week or once in 2 weeks, depending on how often they go for swimming.
So now you get hairsprays that you can do it on your hair before you swim. Would that make any change?
It's something like a water barrier, the waterproof barrier, right? So it acts like how I mentioned that they can oil their hair. Sprays also to an extent work like that. It kind of forms a waterproof barrier around your hair. So that doesn't allow the chlorine to directly build up onto your cuticle.
Got it.
So that is how it can protect your hair. Yeah, you can use it, but again, these sprays, they need to check, what is the ingredient of the sprays. Because most of these sprays comes with, to make it into the aerosolized form, right? To make it as a spray aerosol, there's a lot of chemicals that go into it. So I would say the safer option would be to apply oil, but the quicker and easier way may be spray. So yeah, that can be used.
Got it. And last, but is there anything you would recommend dietarily to make sure someone has good hair health?
So it's very important to have a very balanced diet for the hair. It's not just protein, right? So there are people who apply egg whites on their hair thinking it's protein, but I would rather them eat the egg white. then apply it on their hair. Applying egg white on the hair is just a conditioner, that's it. So if see, for hair, mainly the important things are iron, protein, biotin, and antioxidants. So for iron, like they should get their good load of green leafy vegetables, or even consume say dry fruits like dates. And for protein, depending on whether they're vegetarian or non-vegetarian, again without the whey protein. So to go the more natural way, like whatever's possible in their food, and as simple as sprouts or boiled egg whites. And then for the biotin, so they don't need to take special biotin supplements, because that is now kind of disputed. Because just taking plain biotin supplements has, they're saying that there's a lot of cardiac side effects, like the heart-related side effects from taking just a plain biotin supplement.
Yeah.
So for biotin in the diet, you can get it from almonds. So I would recommend daily, say 8 to 10 almonds a day. It need not be peeled, it need not be soaked, like nothing, none of that, right? No drama there. Just have the raw almonds, 8 to 10 per day. That also works. And for antioxidants, there's this whole thing of the seeds, right? The pumpkin seeds, watermelon seeds, flax seeds. So all of that can be combined, and that can be had. And then the green tea. So particularly the mint flavored green tea works really well for the hormone related, like the PCOD related or the male pattern baldness.
Got it. So I think that's like a whole full-fledged thing that I would say that, to have good hair, you need to start off with eating well
Yes.
and
And exercising.
and exercising well. Yes, that is 100% true. Because some males actually complain that since they go to the gym, they assume that they have high testosterone. And then they will message you or come to you and say, I think I have high testosterone and that's why I'm balding. Is that actually true?
Not necessarily. No, not necessarily. So the thing is, like again, if they're taking whey protein, that can spike up the testosterone levels further, right? So that can cause some amount of hair fall. But I wouldn't no, like high testosterone levels in males causing hair fall is it's very kind of it doesn't work that way for men.
Yeah, it works for women,
It works for women, but not for men.
for men.
Yeah,
Great. Okay. Thank you so much, Apoorva. I think it's been a great conversation with
Yes, loved
understanding
it.
how the hair follicles actually work, what is the transplant journey like, and what should one expect actually. So I think thank you for being on this show, and it's been wonderful.
It was my pleasure.